Hey guys, I'm Dr. Josh. Welcome to our blog. This is episode 2 about stem cells. Boy, a lot of mystery about what stem cells are and how they're used in treatment. Well, today I'm going to actually tell you what they do in treatment, and then I've been a part of over 400 of these injections, so I can tell you what realistically to expect, okay? So let's start off with what is a stem cell? Well, a stem cell is a blank cell that can adapt or change into any other type of cell, whether it be an eye cell, a liver cell, any of those, a stem cell can convert itself into that. And so you see, when a baby is an embryo, okay, it's just a clump of cells. And you see, cells have to eventually become hair cells, eye cells, liver cells, heart cells, but they all start off as the same blank cells. So they start off as 2 cells, and then they exponentially keep turning over and over again until my adult body is about 46 billion total cells, constantly communicating. Now, right now, I am a younger guy, so I have more active stem cells right now in my body that can help heal and repair. Now, the older population, the older that you get, the less viable your stem cells are at healing yourself. So that's why kids, when they're like 5 or 6 years old, I mean, they can cut themselves and their body will heal and there's no scar tissue and it just heals incredible. Well, that's because their body has a lot more viable, healthy, healing cells. And so where do stem cells come from? Well, you can harvest it from your own bone marrow, you can do it from your own fat, or what can happen is that after a child is delivered through a C-section birth, this amniotic sac has a layer that is filled with this fluid called amniotic fluid that's filled with growth factors that can also help heal and repair areas of damage. Now, where we use this in orthopedic medicine is we use this in joints, in muscle tendons, and in ligaments. And the reason that we do that is because the body does not get a very good blood supply in those areas. And so when you tear an ACL, or you have cartilage that's worn down in your knee, well, they're not going to heal very well on their own. So what happens is when you get these cells and you inject that into the area, they start to communicate with the cartilage cells or the muscle tendon cells, and those cells send chemical messages to tell these stem cells to adapt or change into cartilage or muscle tendon cells or ligament cells and try to repair that damage. That way, they don't just keep multiplying and then you grow all of a sudden a massive meniscus that's 4 feet long, okay? It doesn't work like that. Your cells constantly communicate with each other, and so they can tell stem cells what to become and how to repair themselves. And your body is incredible at healing itself. And so these cells right now are so exciting because you're able to use it to help avoid surgeries. You're able to inject them into sites that have had a surgery, and then they help repair the area and decrease scar tissue formation, bouncing you back faster. And so you're seeing this with professional athletes all the time. So Andrew Luck got stem cells in his shoulder. Adrian Peterson, after he tore his ACL, it was so bad that used to, I mean, if that guy would have injured that 20 years ago, never would have been on the field again. And the guy comes back and is running faster than he was before he even tore the ACL. So in medicine, this thing is just changing medicine altogether. You're going to see these things become commercially viable in the next few years, and it's going to be a standard practice of care. And I'm really excited about the future of these things. And so let's get into what stem cells can do in treatment and what to realistically expect. Well, you see, if you're bone-on-bone arthritis, and you have no cartilage left and the bone's all deformed, don't think that injecting stem cells is going to grow an inch of meniscus and cartilage back and you're going to have the knee that you had 25 years ago. Doesn't work like that, okay? These cells are very good at trying to repair an area that is starting to wear down, but you still have to have some cartilage left, and stuff like a meniscus tear. That tear has to still be clean, meaning that part of the meniscus can't peel back like peeled paint, okay? Because then it's not gonna fill in that gap like that, all right? So I want you to picture that you've got a wall and you've got all this peeled paint on it. Well, the first stage is you'd have to sand that down and then you could paint over it. Well, it's the same type thing with stem cells. If you've got a flap that's torn off on a meniscus, this thing's not going to work. All right, so that's why it is important that when you go into your doctor actually orders a thing like an MRI, is going to do an examination and has experience with these cells, because if you've got a full rotator cuff and these two muscle tendons are separated apart, doesn't matter how much cells I inject in here, it's not going to grow a bridge of 3 inches here, okay? So partial or incomplete rotator cuff tears, it has worked wonders because these muscle tendons don't get a very good blood supply. So these are the types of things, guys, when you're considering going to an office to get a stem cell injection, it is really, really important that you go to someone that is realistic with you. Because I'm telling you right now, if I feel really, really bad if a doctor just gets educated about this stuff, has no clinical experience of using it, and then, you know, they do an injection on you and that thing is completely torn and it had no chance of working. So there are viable options, and it works wonders with mild to moderate OA, osteoarthritis, and partial rotator cuff tears, tendonitis, bursitis. It is absolutely incredible, but you need to be around a doctor that understands that stuff. And so if you found our video helpful, please subscribe to the link below. Check out some of our other videos because we've got a lot of great content in there.